everyone, my name is Avinash Sandhu, and I just finished my first year of my SCM program at the Bloomberg School of Public Health in the MMI department. And I just wanted to take a minute to talk about my experience with SOURCE and the Baltimore Action Project this past year. So I worked with House of Ruth, Maryland, and my project was looking at food insecurity in the victims of intimate partner violence. And specifically, I was evaluating the food pantries and looking at best practices to increase access for these food pantries, and also to look at what was preventing the community from accessing the food pantries in the first place. And I had an amazing time. It was very fulfilling and very rewarding. And I learned so much about the Baltimore community, and specifically about a lot of the Hispanic immigrant community in Baltimore, and how food insecurity just shapes so many people's lives. As a biomedical researcher, my research focuses on bacteria and viruses and vaccines and a lot of basic science research. So getting an opportunity to work in social science research has been phenomenal. It's really opened my doors to understanding the different kinds of research, and just has really brought me closer to the Baltimore community that I live in. So I would highly recommend that if any of you are interested in volunteering or giving back to the community, the Baltimore Action Project is a phenomenal way to do so. It was very rewarding, like I said. It really gave me a lot of skills and helped me understand the community better, and it's something that I will carry with me for the rest of my life. So if you're interested and want to give back to the community, this is a fabulous way to do so.
As part of my Baltimore Action Project titled Healthy Foods for All, I had the opportunity to work at Barclay Elementary Middle School with an amazing group of Child First Authority team members, the organization that sponsored my project. This project has had a tremendous impact on my time at Hopkins, mostly by providing an opportunity to really engage with the Baltimore community and understand the rich history that Hopkins has in that community. Being an out-of-state student, a lot of this was new to me. This experience has really put into perspective the work Hopkins puts into not only understanding its role in advancing medicine, but also in helping grow and further the community that it's based in. Outside of this, the project has really helped expand my project management skills in areas outside of my field of study, health administration, and instead in areas such as nutrition and food insecurity. I'm grateful to have had the opportunity to form lasting relationships outside of Hopkins and work on projects that I feel have truly impacted Barclay students and their families.
Hi, I'm Annika Skansberg, and my project was creating a new volunteer training for the 24-hour parenting helpline that's run by the Baltimore organization, The Family Tree. The impact that I think my project will have on the community is just helping volunteers who run the parenting helpline be better equipped for the job they're going to do. And that includes things like being able to navigate resources in a better way, and also when they're starting their job, being more well equipped and comfortable with what they're going to have to be doing when they're on the line. And what I've gained from my experience being a SOURCE service scholar, I've just learned that when you're working with a community-based organization and a lot of different people, you have to be really flexible. You have to be really honest about your time and what you're going to be able to do, and you should set big goals for yourself in the project, but you have to be willing to change those goals as different things come up throughout the year.
Hi everyone, my name is Jeffrey. I'm a medical student at Stanford and a MPH candidate at Johns Hopkins. And today I'll be talking about how we utilize community networks and barbershops and salons to address the COVID-19 vaccine hesitancy within Baltimore. And as we know, especially earlier on, there were higher reported rates of vaccine hesitancy within Black and Brown communities. And so we thought this would be a great way to address health equity by promoting greater education surrounding the COVID-19 vaccines. To do so, we had established a relationship already with the 1009 East Lombard Street Barbershop. It's a very well-established barbershop with strong community roots. And in speaking with them, there were a lot of the barbers there that expressed interest in addressing the misinformation that was currently being spread around the COVID-19 vaccines. We ended up developing a Qualtrics survey that we used, and then developing a QR code that people could scan at the barbershop. In case that came up, we would put this at each of the we did put this at each of the barbershop, like on the dresser or on the shelf next to where they were practicing and cutting hair. And this would give people a chance to, scan this, and it just said like interested in the COVID-19 vaccine, skeptical of the COVID-19 vaccine, And then people would scan that code and be taken to the survey. And then once they went to the survey, the QR codes linked them to this questionnaire that provided links to social media materials on TikTok, Instagram, YouTube, written information with frequently asked questions, as well as Q&A panels with experts, or just to send their email to say, I'm interested in learning more. Who can I find out more about this from? And then that form, again, allowed people a chance to reach out to Johns Hopkins public health students or medical students if they had further questions. As of now, this was distributed to the 1009 East Lombard Street Barbershop, as well as a few salons in the area. And the barbershop clients were able to engage in this public health discourse by viewing the educational videos and accessing written information on the websites. We're really proud of the way that we were able to address a current need and a growing issue within Black and Brown communities here in East Baltimore.
So hello everyone, my name is Margarita Correa. I use she, her pronouns. And today I'm going to tell you a little bit about what I've been working on since late October, early November with the Shepherd's Clinic, specifically as it relates to developing a vaccination education and community outreach program. And just to tell you a little bit about the Shepherd's Clinic, this clinic is located in Baltimore City near Clifford Park, and it serves around 9 zip codes in the city, and it primarily serves adults that do not have health insurance. What I've been working on mainly is trying to identify evidence-based approaches to inform the community in ways that work. We're primarily addressing adults, so we thought that a way to reach them would not necessarily be Instagram or Facebook, although we are trying social media as well. But we thought a little bit about going back to the good old postcards and try to send that in the mail. And so this is an example of that postcard. And basically what it has is key messages. I come from a very different background that had zero community-oriented work. I am a lab scientist, so I was in my bench all day long, not interacting at all with any community-oriented issues whatsoever. And so for me, it was very hard to believe that people would not want to get a vaccine. Like, why wouldn't they want to get a vaccine? But through my experience, I have learned that it's not that simple, and that you have to work towards building trust. You cannot simply walk into a room and yell vaccines are safe and that's it, everyone get a vaccine. Clearly, that's not the way it works. You need to build trust, and you need to do this through communicating with empathy, recognizing that others come from different lived experiences, and that they are very valid reasons to distrust the system and to distrust government agencies and medical practitioners. So you gotta work, meet people where they are, and work from there. This was an awesome learning experience for me, and I feel like I've grown immensely, and I'm looking forward to continue to volunteer and just be engaged.